This question comes in all the time. Should I be on HRT, women who are entering menopause or in menopause? I feel like if we actually knew whether they're at risk for certain cancers because of the way that they're metabolizing their estrogen, because of their genes, a very specific kind of answer could be given. Without that level of detail, you're using other metrics to answer whether they should be on HRT or not.
The conundrum facing many of the patients walking around and into our Chinese medicine clinic has been this. On one hand, most people are aware that if they use HRTs, which is these hormone replacement therapies, the symptoms like hot flashes, vaginal dryness, UTIs may just go like that. And if you went and read around on the internet, you would also realize that early adoption of hormone replacement in your mid to late 40s can really improve your brain and bone health. But the fear is there. The fear is about cancer, right?
Yeah, so these were basically case studies provided by a naturopathic doctor who's using this genetic type of approach to personalize the treatment plans she's giving her patients when they come in with symptoms linked to female health. One thing, for example, is even if there is no history of breast cancer, family history of breast cancer, there may be a genetic predisposition, which would then make her cautious around whether HRT is recommended or not. Because of the way that estrogen is metabolized. So estrogen has three different types of metabolites. There's the 2-OH, the 4-OH, and the 16. 2-OH is considered like the good non-cancerous type, but there are some people, because of their genetic makeup, that shunt things to the cancerous type of breakdown products of estrogen. With those types, it's important to be cautious about giving HRT.
Somehow by doing the genetic testing, you will know the tendencies, then this person should not use HRT in a way.
Exactly, because then you're giving them more of estrogen, which they are shunting into the cancerous breakdown product, which increases the pressure on their body to potentially develop something like a cancer. Okay, so do you see estradiol here? Estrone, estradiol, estriol. These are the three types of estrogen, E1, E2, E3. As the body metabolizes them, does so into these three breakdown products. 2-hydroxy, 2-OH is considered just fine. But 4 and 16 are the cancerous metabolites. Now, depending on you as a person, you break this down differently. Now, there can be a genetic predisposition that shows you're breaking it down more into the cancerous metabolite types. If someone is not breaking down their estrogens healthily and into the good metabolite, the 2-OH, we have to be very conscious about the exposure to xenoestrogens, because xenoestrogens are these kind of fake estrogen type molecules that are found in a lot of processed chemical products that we get exposed to these days, your cosmetics, beauty products, detergents, and so on. We could say that an urbanized person is very much exposed to these in general. But on top of that, if there's a woman who's breaking down estrogen in general into bad metabolites and she has a poor clearance of xenobiotics, that's another type of profile which this genetic data is able to capture. And then you would know that you especially want to help her to A, reduce exposure to xenoestrogens, and B, support her liver detoxification pathways.
I can see now. Okay, so this is the second one. The first one is what's the profile, what's the method?
So the first one is someone who is just overall poor clearance of estrogen into the cancerous type of metabolite. So you want to be careful on HRT for something like that. The second one is poor clearance of xenoestrogens. So you want to be especially working with them to reduce exposure to xenoestrogens and support their liver detoxification pathway, which is how the body tries to break down and detoxify itself from such exposures. And that can be done through, different herbs, foods, and supplements.
So this second person, is there a recommendation for them not to use HRT?
The fact that they're poorly clearing estrogen is an indication that in general you want to be careful around the exposure to exogenous estrogen, meaning external estrogen that's given to them. This train of thought around how does your body actually break down estrogen is different, because if it's breaking down estrogen into the breakdown product that is more cancer prone, then should you be giving the body more estrogen when it's struggling to break it down in a way that is keeping the body safe from developing cancer?
Yes, I totally understand you. So, does this test give a free pass to some women?
Yeah, so some women are breaking it down well into that 2-OH metabolite, which is the non-cancerous type, for which depending on their symptom picture and where they are in their perimenopause menopause phase, HRT could be just fine and in fact indicated.